Hi everyone, my name is Anya Gupta, and I'm honored to be sitting down here today with Mike Thomas, the CEO of John Muir Health. He's a leader navigating one of the most complex industries out there, healthcare. From business strategy all the way to mental health equity, we'll be exploring what it really takes to lead a system that impacts thousands of lives every single day. So, Mike, as a CEO, you have to make a lot of decisions on a day-to-day basis. What's the most strategic decision you've made this year? And what did it teach you about leading a health system today?
Well, Anya, as you probably know, healthcare is facing some of the most challenging times financially in my entire career right now. And we are doing lots of things to deal with that. But one of the things I'm really proud of is we are continuing to invest in growth in our community and expanding our services and expanding the number of people we care for. And that's consistent with our mission, which is to improve the health of the communities we serve with quality and compassion. So I'm really proud that I work for a health system that is, despite the challenges, continuing to invest in expansion and growth.
Wow, that's very nice to hear that, just because there are financial issues, you guys aren't stopping there. And especially John Muir specifically is still continuing to invest in growth. That's very nice to hear. So in a system as big as John Muir, speaking of system, how do you make sure people feel like more than just a badge number? And I'm asking this because as a volunteer at John Muir, I know how amazing it is and how everyone feels so valued, including myself.
Yeah, well, you may know, since you are a volunteer here, that we have about 6,500 employees. We have about 1,000 doctors that support John Muir Health, and we have about 500 to 600 volunteers. And when I transitioned into this role about 3 years ago, I set 3 priorities for the organization. One of them was employee engagement, the second one was physician engagement, and the third was financial stewardship. So 2 of my top 3 priorities for the organization are about people, because at the end of the day, it's the people who deliver the care. It's the doctors partnering with our employees and our volunteers who make John Muir an amazing place to get care. We do all kinds of things to help improve engagement for our employees and our physicians.
Wow, Mike, it's really nice to hear directly from you, the CEO, as of, I think you said 3 years, right? It's really nice to hear directly from you that systems such as John Muir Health, which is a huge healthcare system, prioritizes the people rather than, like the data and the stats and all of that. Because as you said, it's the people that are at the end of the day leading the system and, in the system. So that's really amazing, directly to hear from you in that aspect. So I have a question for you that a lot of students around Bay Area were curious about. So I'm saying this for all of them. What's something you believe is possible in healthcare, even if most people think it might be unrealistic?
Yeah, in our country and in our service area, there are known health disparities among different populations of people. And so I really like the fact that with additional data and artificial intelligence and additional focus, honestly, at a leadership perspective, I really do think health equity is an amazing goal for the entire country and for John Muir Health. And there's a lot of work to be done there, but it's work that needs to be done because, again, our mission to care for the community, it's all of our communities and it's all of the most vulnerable populations. So I really think health equity is an amazing goal for the entire country and for John Muir Health.
Yeah, Mike, that's an amazing insight, and I think this is really important for many other people to hear it, future leaders as well, because health equity should definitely be prioritized, and it's nice hearing directly from you, about that. So, as the CEO of a healthcare system, specifically John Muir Health, there must be lots of business involved, on the business side, but how do you stay connected to the patient experience and healthcare side of John Muir?
Yeah, well, a couple of ways. One is I've lived in this community for 30 years. John Muir Health has been my family's healthcare provider for 30 years. I know a lot of people in the community, having lived here for a long time, and there's probably not a day or two that goes by where I don't get some feedback from either friends or family or neighbors who have interacted with our health system in one way, whether it's in our clinics or in our hospitals. So I get a lot of personal feedback from people that know me. But also I spend a lot of time in the hospitals and in our clinics talking to our providers and our employees, and also at times talking to our patients and getting feedback directly from them. And fortunately, the vast majority of feedback is overwhelmingly positive, that people in our community really value John Muir Health as an incredible asset for the community. But once in a while, there are areas that I hear about that need to get fixed and improved. And so I think going out firsthand and hearing from employees and patients and rounding allows me that opportunity.
Wow, nice. That's really amazing to hear that, just because you're CEO, there's like this stereotype that, like the CEO is just in their building all day. They're not connected with everyone else in the hospital. No. But then you kind of like, you break that myth, like you do the complete opposite. You walk around the halls. That's how I met you. And, you're very connected to everyone, like all sorts of people in the hospital. And I think that's very amazing and very important for, the future generation to continue. What you're doing right now is just so amazing, and I'm honestly inspired by it.
Well, as you said, you and I have bumped into each other on a few occasions in the hospital.
Yes. Oh yes, for sure. It's every time, like I've seen you, I honestly didn't know who you were at first, and then someone who I was volunteering with said that, you're Mike Thomas, and I was like, Mike Thomas? And then I was like, oh, the CEO of John Muir. And I was like, what's he doing walking around? And then that's when I learned that, that's how you create that community, and you like stay connected with everyone and the patient experience as mentioned. So it's really amazing. So can I ask you, did you attend college in the US?
I did.
What college did you go to?
I went to Claremont McKenna College, which is a small school down in Southern California.
That's nice. I have a friend that goes there actually. That's a great college. Wow.
Yeah.
So can I ask you, is there something you learned at Claremont McKenna College that you still use all the time in your role as a CEO?
That's a great question. And my answer may surprise you. So I grade school, and I played soccer for 4 years at Claremont College. And one of the things I learned from being a captain of the soccer team for 2 years was that this philosophy of leadership, where I think it's really important when you're leading a group of people to focus on the positive things and the strengths about each individual person, as opposed to focusing on their weaknesses or things or areas they need to develop. And I think everybody has strengths and everybody has weaknesses, and I have found that to create a high-performing team, it's best to look at each individual and how do you take advantage of their unique strengths. That worked on the soccer field, and that has translated really well to my entire professional career, and that's how I lead people.
Wow, it's so inspiring and cool, and I definitely would not have expected that. Something you learned at college from playing soccer is something that now you're utilizing in your everyday career as CEO. That's really amazing. And honestly, it's also it serves as a reminder that like all college students, will get something out of college. I feel like a lot of students, especially here in the US, they expect that they go to college just so that they can get a job and, hopefully get a good education. But a lot of students tend to forget, the real reason why they're there and the skills that they expect to receive from it. So like the leadership skills and like the, focusing on the positivity that you learned from playing soccer in college, it's amazing and also inspiring to hear how you're using that still in your daily life as CEO of John Muir Health. So that's really amazing. So I have another question. John Muir Health invests heavily in mental health and health equity, as you know already. So what drives that commitment, and how do you know when that's actually working?
Yeah, well, first of all, I'm really proud that our health system is one of the very few health systems in the entire state of California that offers comprehensive inpatient and outpatient behavioral health care services for pediatrics, adolescents, and adults. And it's not something we do because it's profitable. It is actually not paid very well. It's not reimbursed well. But we all know that there's overwhelming demand and need for behavioral health services. And really, I think I'm so proud that our board of directors has the courage to say this is a really important service for our community. And it's a priority for the board of directors to continue to make sure the community has access to those services. And I think that's one of the ways that I measure is, does the board of directors still support this as a vital community asset? And the answer is overwhelmingly yes.
Wow, that's really amazing that you guys are doing that not because it's something that makes money, not to financially grow the system, but because it's the right thing to do, and it's something that's very rare, as you said, in a lot of, the hospitals in all of the state of California. So that's really interesting to hear, that it's such a, I guess, simple thing, but of course easier said than done.
Yeah.
But it's something that you've worked on with everyone at John Muir, and it's something that you guys are continuing, that's working on improving, mental health and equity at John Muir. So
it's very hard, we've learned, to address medical health when there's a behavioral health issue. So you have to address both the mental health issues and the medical issues if you want the best outcomes. And that's what we've learned. That's why it's really helpful that we can provide both.
If that's really important, then why is it so rare that hospitals do that?
It's rare because it's so under reimbursed that it's a big expense for health systems. As I said, I'm proud that our board has prioritized that as a vital community service. Both health systems can't afford to pay for mental health services.
Wow, it's very amazing that you guys are able to however John Muir was built. There's one spot and you guys found it, and you were able to prioritize it. So I really hope that's one thing that the next generation will be able to prioritize. That we'll be able to also work on behavioral services, because as you said, they're intertwined with physical ones. So that's really amazing. So this question is also actually asked by students. I'm also a college student, and I asked a lot of my friends, and exactly 16 people wanted this question.
Wow.
So what's one story or moment in the past year that reminded you why you do this work?
That's a hard one to answer, because I think for me, I am so motivated to get up every day and come to work. And I'm motivated because I know what amazing organization this is, and I know how much the community values having access to world-class healthcare right here close to home. And so I spend a lot of time, as we talked about, out in our clinics and in our hospitals, and just walking the floors and seeing the amazing job that our doctors and our patients and our volunteers do to take care of the community, and seeing how much the community appreciates John Muir Health.
Yeah.
That brings me great joy, but it also reinforces just the amazing asset that we have here to steward, so that it's available for generations to come in this community.
Wow, it's really amazing, that you're inspired and you're motivated to get up every day just knowing that how hard everyone is working, volunteers, doctors, everyone in John Muir in the system. So it's really amazing to hear that, because there's this big stereotype, at least in students, when people think about CEOs, they think that the CEOs are at the top, they're the ones that are most stressed, they don't get any time. And it's really nice to hear that that's not how CEOs actually are. Especially you as the CEO of John Muir, you're able to prioritize, you're able to focus on the human connections and the importance of the people in the system, not the system itself.
That's all true, but I don't want to mislead you. There is stress that comes with the job, and so, particularly in light of, current events. So you can't pick up your phone and look at the news and not hear about threats from the federal government or state government to cuts to Medicaid, which in our state is called Medi-Cal. Those kind of things are beyond our control, but they have a huge impact on not only John Muir Health, but every hospital and health system. So there is a lot of stress because there's a lot of change going on in the industry, and financially, most of it is creating more challenges, not less.
Can I ask you, you said that there's a lot of financial problems earlier and right now.
Yeah.
What exactly is causing those financial problems?
That's a great question. So it's really about demographics, and I'll explain. 17 years ago, when I started in this organization, when I first started working at John Muir Health, half of our business came from patients who had employer-sponsored insurance, and that pays us very well. And half of our patients had government-sponsored insurance, and that pays us really poorly. And the government-sponsored insurance comes in two forms. There's Medicare, which is for those generally for those 65 and older, and there's Medi-Cal in our state, which is for individuals and families who have their income below a certain threshold level. And what's happened in the 17 years since I've been in this job, and this is true for the entire country, our demographics in our country have changed. They've aged, and there's been a lot more people added to the Medi-Cal roles. And so today, fast forward 17 years, 72% of our patients now have government-sponsored insurance that still pays us really poorly, and only 28% of our patients have employer-sponsored insurance, which still pays us well.
Yeah.
But now the shrinking pool of employer-sponsored insurance is not enough to cover the losses that we have on the government-sponsored insurance. So really, what's causing the tension in the healthcare system in the United States is every hospital and health system and doctor is dependent now on the federal government and the state government for 70 to 80% of their revenues, and those revenues do not cover the cost of care.
Yes, and that's a big issue because then it's like financially really, really low.
So I want you to think about that and your viewers when you hear the president and the federal government talking about hundreds of billions of dollars of cuts in the Medicaid system across the country that already pays us terribly. It's just going to create huge financial challenges and will ultimately end up in hospitals and health systems reducing the amount of services they're able to provide.
Do you think they'll be able to maybe like turn it around soon? Like they'll invest more money in healthcare systems?
It's not a priority for this administration at this time. They're looking to take money out of healthcare to fund other priorities.
I really hope that changes soon. It's very important that we have the financial, like the money available in order to keep systems like John Muir running. Because I mean, just talking to you, for a few minutes, it's already amazing to see how far John Muir has come in like the years that it's. When did John Muir start?
Well, our Concord campus is celebrating its 90th anniversary, and our Walnut Creek campus is celebrating its 60th anniversary.
Wow! Oh my God! I thought the Walnut Creek one came first.
Oh, Concord campus is the oldest one in this county.
Wow, that's amazing! I'm honored to be volunteering at the oldest campus in John Muir.
Yeah.
Wow, that's really amazing. Okay, so moving on to the next question. This one's actually kind of related to the previous one because we were talking about like healthcare systems in general in California. So this question is, if every healthcare system in the country followed John Muir's lead on one thing, what would you want that one thing to be?
It'll go back to a prior answer that I gave you, which is we're really proud of the fact that we have beautiful facilities. We invest a lot in state-of-the-art medical equipment. We have lots of investments in technologies that allow us to do amazing things. But this real secret sauce in delivering high-quality care are people, as we talked about. And the people need nice facilities, and they need the equipment, and they need the technology, but it's really the skills and experience and the collaboration of our employees and our doctors and our volunteers which creates an amazing care environment. So it's that teamwork and experience. And so I would say for any healthcare leader, the vast majority spend most of their time trying to make sure their people get the resources and the things they need to deliver great care. Because at the end of the day, it's the people providing the care, not the equipment and not the facility.
Wow, that's really amazing, to hear that like the people, like they are the importance, and I think that's something that a lot of people should hear about and understand, because I feel like there's this stereotype that in big systems such as like hospitals, such as John Muir, it's like the system is what's important, and like kind of like that corporate vibe, and people think that that's how it is, but you're kind of, showing it's not like that at all. Like as you said, there are definitely issues, but having that teamwork and having that communication and that human value is what's more important. And I completely agree with you that, if all healthcare systems in the country were able to prioritize that human connection then it would be really different. All healthcare in the country would be different. And I think that's definitely something that's like a takeaway from this interview. So thank you so much for that. So, okay, this one, once again, this was the last question that a lot of students wanted to hear.
All right.
Finish this sentence. In the end, healthcare is really about.
In the end, healthcare is really about making sure that the people you're caring for feel cared for. And if you think about it, with very few exceptions, most people don't want to come to the hospital. They don't want to come to the doctor. They usually come to the hospital or the doctor when they feel terrible, when they have life-threatening illnesses, and when they're at probably some of their most anxious and worrisome points in their entire life. And so you can deliver great care, but if you don't deliver care, if you don't deliver it in a way where the patient feels that they're being cared for, it's not going to be as good of an outcome. So I think really making sure that our patients and their family feel that we are caring for them and that they're cared for is as important as the medical care they receive.
Wow, Mike, thank you so much for this. I think that's really, really important, and it's nice to hear that, as the CEO, it doesn't mean that your perspective changes on the healthcare system. It doesn't mean that you think of it in more of a systematical way, which is kind of what we've been talking about this whole time. But it's nice to hear that, you think from the patient's perspective. You think of how the experience should be for them. And I think that's very, very important. And I really, hope the next generation continues that and prioritizes not the system, but the people that are using the system. And everything you just said was seriously amazing. So thank you so much for sharing that with us.
Okay, I have one more comment for your listeners, if I can.
Of course.
You should all consider a career in healthcare. It's amazingly rewarding. We need, because of the aging demographics, we need a lot more people who are interested in healthcare. So I hope this has inspired some of your listeners to think about healthcare as a career.
Thank you so much, Mike. You guys heard it straight from the CEO of John Muir Health. If you're thinking about getting into healthcare, this is your sign. Go to it. Do it. So this is actually my last question.
Okay.
So if you could be 16 again, is there anything you would do differently?
If I was 16 again, I would tell myself to take more risks. I think, when you're young, you're worried about making mistakes and you're worried about maybe extending yourself a little bit. Like, by the way, you're doing a beautiful job extending yourself in this interview. But I think I would encourage myself to take more chances and take more risks and put myself out there a little bit more than I have. As I've gotten older, I've gotten way more comfortable in my own shoes to do that. I just wish I had that kind of courage earlier in my life.
Thank you so much, Mike. I think that's something that genuinely a lot of students, including myself, need to hear. Because right now, I feel like a lot of students, or teenagers, I guess in general, are at that point in their life where they do take risks sometimes, but not the way that you were saying, not like try, and if it works, then I think that's kind of what you mean, right? You try it once, and if it works, then it works. If not, try again, try something else. And I completely agree with you. I think this is a time in our lives that, students and teenagers in general should be going for what they want. Because right now, there's this I don't know the word for it, but it's like every student that goes to school is told, get a 4.0 GPA, have extracurriculars, get into a good college, go to college, graduate, and that's it. And then just find a job, you're out there on the real world, figure it out. That's kind of what's being told to everyone, which is why there's not as many, not necessarily entrepreneurs, but, people that go in unique paths. So I think it's really nice to hear directly from you that, everyone should be taking risks right now and trying out new things, trying out whatever they want to, the dreams that people go for, which I know sounds cliche, but, go for your dream. Kind of, that's what you're saying, right?
Yeah, and force yourself to get out of your own comfort zone once in a while. That's how you grow as a person. And I think that makes you a much more interesting person. So that's really the message. Again, don't be afraid to get out of your comfort zone once in a while, even if you fail. But sometimes you learn, most of the time you learn way more from your failures than you do from your successes.
Thank you, Mike. Yes, I completely agree with you. It's like if you never go out there and make that mistake, then you're bound to make it eventually. So might as well just make it and then move on and improve from it, all right?
Right.
I completely agree with you, and thank you so much for taking the time today to speak with us and talk to us about all sorts of things that we covered today. Talking about literally how you used what you learned in school and soccer, about leadership and seeing the positive in people, and even about how people are very important. I feel like that's one of the key takeaways from this, prioritizing the people, not the system, because the people are the ones using the system. So thank you so much for everything that you talked about today.
Well, Anya, I'm honored that you had an interest in healthcare and learning a little bit about John Muir Health and my leadership perspectives. Thank you.
Yes, I just want to say to everyone that I'm a volunteer at John Muir currently, and it's amazing. I can I can 100% confirm that John Muir is one of the best healthcare systems that I've ever, or I mean personally the best one that I've ever seen. It's just, there's like this community that somehow like everyone at John Muir has collectively built. It's like a family almost, and I know that sounds like, it sounds a little extreme, but like, I'm really being honest right now, so it's really amazing.
Well, thank you for volunteering and your support of John Muir Health.
Okay, thank you guys so much, and thanks for tuning in to KFN.